So it's been a really rough year for Haiti, and of course if it's a rough year for Haiti, it's rough for Partners in Health. But we've had amazing accomplishments together with our team. It's our first year AE, after earthquake. And we've already started making massive strides to build the new hospital at Mirabelais, which is going to be a real symbol of the reconstruction of Haiti. And we're very excited about that, and that's well underway. Unfortunately, but not surprisingly, Haiti got hit with a terrible epidemic of cholera, and we've had to respond rapidly to a disease that we were very unfamiliar with, and set up both the cholera treatment centers and a community-based strategy for cholera, and we became really the central repository for that work with the Ministry of Health in St. Mark, which is where the epidemic was first identified. It took really a couple of weeks to set this up well. We had great partners with Operation Blessing, who did the water for us, with Doctors Without Borders, who had more experience in some of the countries with dealing with cholera. And then on the academic side, we were able, with our partnership at Harvard, to really leverage a large academic community that came out and made a very good joint statement on cholera, calling for vaccines, more aggressive treatment, and of course water and sanitation. And now we're one of the main training sites for cholera in Haiti. One particular challenge that we've addressed in a very novel way is our maternal mortality reduction project in Lesotho. Lesotho is by far our most difficult country in terms of terrain. As a result, there's an extremely high maternal death rate. Women die in childbirth because they can't get to adequate care. So using our classic model of community health work linked to health center, linked to hospital, we have put together a really novel program whereby traditional birth attendants are retrained to be community health workers and really accompagnateurs of pregnancy. They're responsible for getting women to attend antenatal visits and to deliver in facilities. And in the two big sites that we've implemented this program of, improving the facilities at the health center level for delivery, training the traditional birth attendants in a much more broad and medical fashion, and then having transport so that people can be taken to a district hospital if they need a C-section. We've increased the number of deliveries more than 300-fold, and we've had no maternal deaths yet. So that's very exciting. Similarly, in Malawi, a country that has historically had one of the more aggressive programs to treat HIV, I think they have over 200,000 people on the government program who are being treated for HIV. What they don't have is a very good retention and care. And the government has now commended Partners in Health and publicly said that our program within the government is the best in the country. Our default rate is incredibly low, less than 2%. We have an exceptionally high then retention and care. And how do we do this? Same way, really engaging the community as village health workers who are paid to do that kind of accompaniment, who deal with the whole family, not just a person who's sick. And they're, of course, linked in the same way to health centers and hospitals, but that community piece in Malawi was something very novel. And then on the hospital side, our wonderful, marvelous accomplishment is the opening of the Butaro Hospital in Rwanda, which is a beautiful, state-of-the-art hospital in a very remote district that had no hospital at all, that also had, again, one of the most high maternal mortality rates in the country, given the mountainous nature and the difficult roads. And I think what we're probably most proud of, again, in true partnership with the government, that the government has really outfitted that hospital with the supplies, the beds, the operating theater, in the neighborhood of $1.5 million of equipment. So it really is a true partnership, and we're hoping it will be a model for Mirabelais as well, where we can use that partnership then also to become a teaching facility. We feel like we're winning, even in this horrible financial crisis, by help of all of our supporters around the world, whether they're ministers of health in Rwanda, to people who support our work with donations, to kids who are doing bake sales. I mean, it's a great collaboration that's moving forward.